Assalamualaikum warahmatullahi wabarakatuh. We are from Group 3 and today we want to discuss about microbiological as occupational hazard. The waste management industry or waste industry consists of waste management, waste dumping, waste recycling and to a lesser degree waste prevention. In some cases, health issues are associated with waste management processes. Microorganisms such as E. coli, Salmonella, Aspergillus can play a significant role both in terms of their presence and their potential impact.
The first microorganism is Escherichia coli or E. coli. E. coli is a gram-negative root-shaped bacterium commonly found in the intestine of human and a warm blood animal. Although most strains of E. coli are harmless, but some of E. coli make you feel sick. In the waste management industry, E. coli can be present in an effect of waste stream, particularly those that contain organic matter such as sewage, animal waste or food waste. Workers who handle sewage and animal waste might be exposed to the E. coli.
The second one is Salmonella. Salmonella is a genus of bacteria belonging to the family of Enterobacteriaceae. It is mortal with flagella that enable them to move. And then Salmonella can be present in waste materials that contain contaminated food waste, animal products or fecal matter. Salmonella also are bacteria that make people sick. Then they live in the intestine of people and animals.
So, the last microorganism is Aspergillus. Commonly found in environment including soil, decaying vegetation or organic waste. Certain species of Aspergillus such as Aspergillus fumigatus can produce airborne spores that are widespread in nature. Aspergillus can thrive if the condition have high moisture content or organic material for the fungi to feed on. For example, Aspergillus can be found in a composting operation or in the waste treatments of facilities that handles organic waste. There are two effects of E. coli. The first one is gastroenteritis. A pathogenic strain of E. coli can cause a gastroenteritis or known as a food poisoning. Symptoms including diarrhea, abdominal cramp, and vomiting. The severity and durations of the symptom can vary depending on the strain and the individual factor. The second effect is urinary tract infection, UTI. Certain strains of E. coli can cause a UTI, which is primarily affect the bladder and urethra. Symptoms of UTI including frequent urination, a burning sensation during urinations, cloudy or bloody urine, and lower abdominal pain.
The first one is gastroenteritis. The most common manifestation of Salmonella infection in human is gastroenteritis. Symptoms include diarrhea, which can be watery or bloody, abdominal cramps, vomiting, and sometimes fever. Gastroenteritis typically develop within 12 to 72 hours after exposure to the bacteria and can last for several days. Last but not least, Aspergillus also have two effects. The first one is allergic reaction. Allergic reaction is exposure to Aspergillus spores can trigger allergic reaction in susceptible individuals. This reaction can manifest as allergic rhinitis, hay fever, asthma or hypersensitivity pneumonitis. Symptoms may include sneezing, runny or stuffy nose, coughing, wheezing, shortness of breath and allergic skin reaction. The second one is aspergillosis. Aspergillosis refers to a group of fungal infection caused by Aspergillus species. The severity and type of infection can vary depending on the immune status and overall health of the individual.
In conclusion, there are many ways to overcome the spreadness of microbial. Firstly, we must wear a proper mask and gloves, practice good hygiene management before and after work, And lastly, adequate waste treatment processes such as biological treatment, composting or disinfection.